Hi, my name is Hazik. Introduction: Synthetic vascular graft. Synthetic vascular graft made from advanced polymer materials are a major advancement in biomedical engineering for patients with vascular disorders or injuries. This graft must undergo rigorous in vitro and in vivo testing to ensure safety and efficiency. In one study, a graft implant in a dog showed intense biocompatibility and thrombosis issues, resulting in the dog's death after 2 months. The graft was covered in a thick collagen shell and the vessel was filled with blood clots. This highlights the need for extensive preclinical testing and ongoing research to improve graft integration with host tissues and prevent
The
adverse
failure of
events.
implanting an artificial vascular graft into a dog can be related to the host biological reaction against implantation, where the body reacts badly and completely rejects the vascular graft. Acute inflammation is the first biological response that occurs at the tissue injury on the first minute. In this response, immune cells like neutrophil and macrophage move into the tissue, engulfing the bacteria to help clear out pathogen, and lymphocytes can infiltrate the wound. The persistent acute inflammation stimuli caused by the chemical and physical property of the vascular graft, chronic inflammation will occur, causing the continuous presence of immune cells like macrophage and lymphocyte into the plantation system. Due to the presence of vascular graft that hinders full healing, foreign body reaction will occur, where the immune system like macrophage try to engulf and digest implant. Unfortunately, the implant is too big, causing macrophage to fuse and form foreign body giant cell. This leads to the formation of granulation tissue, a small area of inflammation meant to result in the failure of vascular graft, where the continuous activity of fibroblasts results in the formation of dense fibrous capsule around the vascular graft. This capsule, composed mainly of collagen, can become quite thick as the body attempts to wall off the foreign object. Due to the collagen shell surrounding the vessel, blood platelets adhere to the collagen when come into contact, which in turn attracts more platelets,
I am going to
causing
explain the approaches to overcome the problem. So one effective strategy is surface modification of the polymer material. By applying coatings of antithrombotic agents such as heparin or nitric oxide releasing compounds, we can prevent blood clots from forming on the graft surface. Creating micro or nano patterns on the graft surface also plays a significant role. These patterns influence cell behavior, improve endothelial cell attachment, and reduce the likelihood of thrombosis. Another promising approach involves the use of biodegradable polymers like polylactic acid, polyglycolic acid, and polycaprolactone. These materials gradually degrade and support tissue regeneration, enhancing integration with the host vascular system. Composite grafts that combine biodegradable and non-degradable components provide initial mechanical support and facilitate gradual tissue replacement, matching the tissue regeneration rate for optimal support. Improving graft design and structure is equally important. By optimizing porosity and pore size, we facilitate cell infiltration and tissue integration while maintaining mechanical integrity. Ensuring that the graft's mechanical properties closely match those of native blood vessels prevents mismatch and complications, leading to better outcomes. So, through these innovative approaches, we are paving the way for safer and more effective vascular grafts, improving patient outcomes and
Hi,
quality
my
of
name is
life.
Muhammad Shazwan, and I will now explain about the biological evaluation based on ISO 10993-1. So, to do the evaluation, we need to know the categorize of the medical device. So, to do the categorization, we need to know the medical device category, what does it contact with, and the contact duration. So, as for the vascular graft, it is an implant medical device, and it also contact with blood, and contact duration is long term, which means it is longer than found 30 out what
days.
is this medical device is categorized in, then we need to see in the table of the ISO to know what are the tests that will be done for this medical device. So for the vascular graft, the biological evaluation tests are cytotoxicity test, sensitization test, irritation and intra-acute reactivity test, acute systemic toxicity test, material mediated pyrogenicity test, subacute systemic. So next is chronic toxicity, hemocompatibility, implantation test, general toxicity test, and subchronic toxicity test. So these are the 11 tests that will be done to vascular graft based on its categorizations.
So hello everyone. So today I will be discussing the development of the new synthetic vascular graft that will be focusing on the critical aspect of material selection and the design consideration that ensure their success. So as a junior biomedical engineer, so it's very important to evaluate the chemical, morphological, and also the mechanical properties of the biomaterial used. So as we can see this here, so for the tissue engineer vascular graft, the biodegradable polymers are very recommended. One such material is polylactic acid or PLA. The degradation by the products of PLA are non-toxic and can be metabolized by the body. This is why we propose the new material is the polylactic acid for the new synthetic vascular graft. Okay, next for the design considerations, the first one is the chemical properties, which is biodegradability, which the degradation by the products of PLA is primarily lactic acid, which non-toxic, as I mentioned earlier. The next one is the hydrophobicity, which is the PLA is a very relatively hydrophobic, which can reduce its rates of hydrolysis. In addition, the PLA is more hydrophobic, we say, because it can limit the water uptake and resulting in a lower hydrolysis rate. This hydrophobic characteristic gives the PLA a degradation duration of 6 months to a year. So the next one is a PLA biocompatibility, which is to avoid adverse immune reactions. So next we move to the morphological properties, which the first one is for the nanofiber structure. So most of the biodegradable synthetic arterial tissue engineered vascular graft use the electrospun nanofiber because these nanofiber structures mimics the natural extracellular matrix, which can promoting cell attachment and also the proliferation and can withstand with the high pressure of the arterial systems. So the next one, the design must be small pore size to prevent the significant blood linkage and also the premature mechanical failure because these pores also facilitate the essential exchange for cell survival and functions. And next one is for the surface modifications, which can enhance the hemocompatibility. Okay, next we move to the mechanical properties, which the design consideration must be flexibility and distensibility. Also, the prosthetic rings or coil as the external support of the PLA for the new synthetic vascular graft. Next is thrombogenicity, and the next one is must provide the high mechanical strength. As we know that PLA, particularly in its semi-crystalline LPLA form, which we can see in the diagram here, it provides the necessary ruggedness, the flexibility, and also the elasticity that's similar to the natural blood vessels, and this can ensure the graft can handle the versatile blood flow without rupturing. So that's all for me. Thank you.
In conclusion, a thick collagen shell and blood clots indicate that thrombosis and pore biocompatibility were the reasons behind the artificial vascular graft failure. Graft encapsulation and vascular blockage were the results of the biological response, which also include inflammation and a foreign body reaction. Surface changes, such as biodegradable polymers for improved tissue integration, anti-thrombotic coatings, and optimized graft designs are critical for better results. In-depth biological analysis in accordance with ISO 109931 are also essential. Important lessons learned include that in order to improve synthetic vascular grafts, extensive biocompatibility testing, surface modification techniques, and optimized design are required.